Adrianne here with the Lynch team at Conway Real Estate, and I have Elaine Poker-Yount with Visiting Angels. Welcome.
Hi.
So today I want to talk about, I was thinking that we could talk a little bit more about the home health care. And as we continue to shelter at home, I just heard the term and I thought you guys were home health. So kind of what's the difference between home health and home care?
Okay. Home health is medical and we are non-medical. So we are, we're the perfect daughters and sons who don't talk back and don't have history, that come in and help you with all the activities of daily living, everyday life, meals, prep, personal care, companionship, all that fun stuff, little house cleaning, taking you to the doctor. Home health is medical and typically rehab in some fashion.
Okay.
So whether it be physical therapy, occupational therapy, maybe speech therapy, a little bit of psych sometimes, might be wound care, medication management, how to adjust to a new condition, how to adjust to maybe having a catheter or something that you have to do medically.
Okay.
So it is covered by insurance, like, usually Medicare or whatever your health insurance would be. And then you need a doctor's order for it. So, but it's 100% covered by insurance, whereas non-medical is private pay, veterans aid and attendance, long-term care insurance, that kind of thing.
Okay. And so you talked a little bit about what you guys do on the home health side. What is, how do you guys work together with home health and home care?
Well, we support home health. So people typically will get home health when they're coming home from the hospital, or maybe rehab. So maybe they were just sick, they had an injury, they had a procedure, surgery, something like that. Again, maybe they just had a little bit of a crash and they're adjusting to new medications, that kind of thing. We work together to kind of support what happens when they get in the home. Maybe they're weak. We're talking about rehab, or even sometimes, we might have somebody at home that's just not been well and they've been laying around for 2 weeks and now they don't have the strength, they don't have the stamina. We can say, hey, let's call your primary doctor or your heart doctor, whomever is the fitting person, to say, let's get a home health order to get some therapy in here, to get somebody in here to kind of help manage this situation a little bit better. And then we can kind of be boots on the ground, say, okay, we're doing physical therapy or occupational therapy, and we have to do it 2 or 3 times a day. Most people don't initiate that on their own. And oftentimes, if it's a couple, the spouse saying, okay, time to do your exercises, they're like, yeah, no. So as professionals, we've got our little uniforms. We're considered, they look at us as professionals. We can say, okay, Jerry, or okay, Susie, it's time to get those exercises in today. But we can do them with them. We get going. We send, as part of our care management team, we'll send one of our team leaders out when the therapist comes in and does the evaluation. We learn what needs to happen so that we can practice with them appropriately. And then our caregivers can mimic and mime the arm raises, the leg raises, getting up, standing up. How do we transfer with a gait belt to get from sitting to standing, or going from a chair to a wheelchair or a walker, and practicing those things with them. And typically we're more patient and we're fresh, we're not tired. And so we've got, those fun ways to do those things, and we can make it more like a game and just kind of help the spouse or the daughter or son or who's ever there to get through it more comfortably, just to make it smooth, and then make sure that we do it 2 times a day or 3 times a day to get that strength up. And now with COVID and families not being able to be in rehab, they're not able to see what's going on. Mm-hmm. Certainly services are more limited with them coming home right now. So usually as they're getting discharged, oftentimes they'll let one family member come in to kind of get trained on how to do it, whereas normally the therapist might be at the home because they'll say, you need to do this at home. And because we are still seeing clients who've been in the hospital or rehab, if they've been exposed, then we've got that waiting period before we can go in and help. But once they clear that waiting period, we can kind of take over that for the family.
Oh, I think that's great. So we will put your information below so they can reach out to you on how to coordinate and schedule with you guys to come do a health check.
Perfect. Sounds great. Thank you.
Awesome. Thank you.
Take care.